Today, we're diving into one of the most commonly prescribed medications worldwide, proton pump inhibitors, or PPIs. If you or someone you know has ever had acid reflux, heartburn, or stomach ulcers, you've probably heard of these medications. If, in fact, at my functional medicine clinic, iLabMD, we often work on this issue of trying to either substitute or at least decrease the usage of PPIs with herbals and non-PPI formulations. So what are PPIs and what should you be aware when you're taking them or if you have to take them? So let's get into it. But welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So what are PPIs exactly? PPIs are medications designed to reduce the amount of acid produced by your stomach. They are incredibly effective for treating conditions like GERD, gastroesophageal reflux disease, and stomach ulcers. And they are used for preventing damage from NSAIDs like ibuprofen and aspirin, etc. Common names that you may recognize include omeprazole, pantoprazole, lansoprazole, and esomeprazole. So they're often taken once daily, and they can provide the relief that lasts the whole day. So how do PPI work actually? So PPIs work by targeting the proton pumps in the stomach lining, which are responsible for acid production. By blocking these pumps, PPIs significantly reduce stomach acid, allowing the esophagus and stomach lining to heal from irritations or even ulcers. So they're generally safe and great actually for short-term use and are recommended by doctors for most people dealing with persistent heartburn or acid-related issues. So, but what are the common side effects? But before we move on, if you're enjoying this video so far, make sure to hit that subscribe button so you don't miss any of my upcoming videos on medical topics that you enjoy. So back to PPIs now. So what are the side effects of PPIs? Well, PPIs are generally well tolerated. They do come with some potential side effects, especially with the longer term use. Here are the most common ones. So headaches and nausea, mild but relatively common when first starting PPIs. Digestive issues. Some people may experience constipation or diarrhea or stomach pain. Nutrient deficiencies, that's a big one. PPIs can affect how your body absorbs certain nutrients, especially vitamin B12, magnesium, and calcium. So long-term use may lead to deficiency, so it's worth keeping an eye on these levels with your doctor, of course. Now let's look at the long-term risks. First is very important, bone health. Long-term PPI use is linked with a higher risk of bone fractures, especially hip, spine, and wrist fractures. This is because reduced stomach acid can impair calcium absorption, which is essential for bone strength. Another important one is kidney disease. Studies suggest that extended PPI use may increase the risk of chronic kidney disease and in rare cases can lead to acute kidney injury. If you are on PPIs for an extended period, it's important to have regular kidney function tests. The other side effects that are very important, especially from the gut health standpoint, are infections. Stomach acid is a natural barrier against harmful bacteria. It's a protector. With lower acid levels, people on PPIs have a higher risk of infections like C. diff, for example, Clostridium difficile, and they're also more prone to SIBO, which is a small intestinal bacterial overgrowth that is often it's called IBS. It's lumped with IBS. Another interesting side effect where the research is kind of ongoing is dementia. Some studies have showed a potential link between long-term PPI use and increased risk of dementia. While this isn't definitive, it's something to consider with your healthcare provider. So when to use PPIs and how to stop them safely? That's a very important question. So PPIs are best to use under the guidance of a doctor, especially if you're using them long-term. Often, they're recommended for short courses, but if you're on them for longer, then you have to work closely with your provider to try to taper them off gradually, as stopping them abruptly can lead to a rebound acid reflux, meaning that your symptoms will come back even stronger. So don't forget, of course, very importantly, lifestyle changes such as eating smaller meals, avoiding trigger foods, and not lying down right after eating. That can also help manage symptoms. In short, PPIs can be lifesavers for those struggling with acid-related conditions, but it's essential to use them wisely. If you are considering long-term use or you have to do it long-term, then talk to your doctor about minimizing the risk effect. In functional medicine, there are herbal and non-PPI formulations that are used, so consider adding a functional medicine provider to your medical team. Thank you so much for watching. Stay healthy and stay informed. Until next time. Bye-bye.